Hey everyone, my name is Haley Pemberton, and my 5-minute video is on primary immunodeficiency disorder. So, what is that? It's a group of genetic conditions that leads to a defect in one or more components of the immune system. There's about 130 total disorders that it could be. It leads to increased infections, autoimmune manifestations, and certain cancers such as leukemia or lymphoma. So going back to patho, we have our innate immunity and our adaptive immunity. Innate immunity is nonspecific. It involves certain cells such as our phagocytes, our natural killer cells, and our dendritic cells. And then adaptive immunity is specific, and that involves T cells and B cells, which the B cells secrete different antibodies to send out, such as IgG, IgM, and IgA. So if you have primary immunodeficiency disorder, you are deficient in your innate or adaptive immunity. Certain forms of it, such as a deficiency in combined B cell and T cells, is called severe combined immunodeficiency. And basically, you have no immune system. It's considered almost absent, and you're highly susceptible to bacterial, viral, and fungal infections. So the only risk for developing primary immunodeficiency disorder is if you have someone in your family that also has this, because it is a hereditary condition. So 3 essential questions to ask. Do you have recurrent sinus or ear infections? Do you have frequent pneumonia? And does anyone in your family have primary immunodeficiency disorder? You want to ask about the sinus and ear infections and the pneumonia, because if someone comes in and they continuously have infections and they're being treated for them and their infection's not going away, you want to suspect this disorder. And then you want to ask about family history, because if someone does have it in their family, they're going to have it as well. So our top 3 physical exam findings are recurrent infections with poor response to antibiotics, failure to thrive, and persistent thrush or skin abscesses. And you have these things because you have no immune system, you have nothing to help fight off infection. So you're continuously being treated with antibiotics, but the infection's not going away because you don't have the support in your body to get rid of that infection. So you're going to be weak. And then when you have decreased immunity, you're going to have those constant abscesses or thrush on your tongue. So treatment for this, there's not anything that can necessarily get rid of it, but you can do different things to prevent infection. So depending on what infection you do have, you want to treat it with appropriate antimicrobials. In some cases, you can do antibody infusions. And then if you have combined B cell and T cell deficiency, it's recommended that you have a bone marrow transplant. Our expected outcomes for treatments are to prevent severe infections and strengthen the immune system. And then 3 priority teaching components. You want to review measures to decrease the risk of infection, such as hand washing, avoiding large crowds and people with infections, no live vaccines, and avoid raw meats and unwashed fruits and vegetables. You also want to encourage thorough dental hygiene. You want to tell them to brush in the morning, after every meal, and before they go to bed. And you also want to floss once a day. And then you always want to do prophylactic antibiotics before dental and surgical procedures. Basically, you just want to do everything possible to prevent infection, prevent germs from entering the body that you could have prevented from being there, and just keep them from being exposed to all those diseases. And that's it. Thank you so much for watching.